Good afternoon, good evening, everybody. Thank you for joining us. My name is Saru Jayaraman, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. Welcome to the series, Public Health Conversation Challenging Public Health. These events are meant as spaces where we can engage with the issues that matter most for health. Through discussion and debate, we sharpen our thinking about the ideas that support a healthier world. Thank you for joining today's conversation. Thank you to the many who work to make these events happen, in particular the Dean's Office and the Marketing and Communications team. This event, this Challenging Public Health series, is a chance to take a self-examining look at public health's performance during the COVID moment, to see what worked and what did not in our approach to the crisis. Through critical examination, we can draw lessons from the pandemic, which we can apply to creating a healthier future. To broaden these reflections, we have invited speakers we admire from outside the field of public health to share their perspectives. Through the lens of outside expertise, we can better see our strengths and weaknesses, looking at our work with fresh eyes. Today, we have the privilege of welcoming a speaker whose work I've long admired. She has long been a voice for progressive change. Saru Jayaraman is the president of One Fair Wage and director of the Food Labor Research Center at the University of California, Berkeley. After 9/11, together with displaced World Trade Center workers, she co-founded the Restaurant Opportunities Center, which grew into a national movement of restaurant workers, employers, and consumers. She then launched One Fair Wage as a national campaign to end all subminimum wages in the United States. Saru is a graduate of Yale Law School and the Harvard Kennedy School of Government. She has been listed in CNN's top 10 visionary women and recognized as a champion of change by the White House in 2014, a James Beard Foundation Leadership Award in 2015, and San Francisco Chronicle Visionary of the Year in 2019. She's also the author of 4 books, including the forthcoming One Fair Wage, Ending All Subminimum Pay in America. She appears frequently in a whole range of media. She also attended the Golden Globes in January 2018 with Amy Poehler as part of the Time's Up action to address sexual harassment series. I'm now very happy to turn the screen over to Saru Jayaraman. Saru, over to you.
Thank you so much, Dean. Thank you for inviting me to join you all, and thank you for all of you being here. I'm happy to be here with you. And I want to share that I've been doing this work, organizing restaurant workers and restaurant owners for better wages and working conditions in the nation's restaurant industry for 20 years. But in my 20 years, we've never experienced anything as historic and seismic and monumental as what we're experiencing right now in the restaurant industry, in the economy, among low-wage workers in general. It's an incredibly historic moment where workers across the economy are standing up for themselves, determining that they will not work for the poverty wages that they've worked for a very long time. And so I'm very happy to be joining you in that very historic moment and thinking about how we might actually work together as worker advocates and the public health community to further this historic moment and create real change for our economy and our people. So just quickly, as was mentioned, I started this work 20 years ago after 9/11, together with workers from Windows on the World, which was the restaurant at the top of the World Trade Center. We started as a relief center for the families of the victims who died in the restaurant at the top of the World Trade Center and the thousands of workers who lost their jobs following the tragedy. But what started as a relief center grew quickly into a national organization fighting to raise wages and working conditions across the country. And everywhere we went across the country, we would ask workers, what are your top needs and concerns? And I myself, I'm an academic and an organizer. I was very surprised that everywhere we went, didn't matter what community, what part of the country, there was a pretty universal answer from restaurant workers. They said, our wages, our wages, our wages are our top concern. And that became clear the more research we did. We found that the restaurant industry has been the largest and fastest growing private sector employer for decades, almost 14 million workers pre-pandemic. That's almost 1 in 10 American workers working in restaurants pre-pandemic. But it's also been the absolute lowest paying employer for generations, dating all the way back to emancipation of slavery, when the restaurant industry first demanded the right to hire newly freed slaves, not pay them anything, and have them live entirely on a newfangled notion that had just come to the United States from Europe at the time called tipping. Tipping originated in feudal Europe. It was an extra or bonus on top of a wage for serfs and vassals that aristocrats gave to their lessers, their inferiors. That idea came to the States in the 1850s, 1860s by rich Americans traveling to Europe, coming back, trying to show off that they knew the rules of Europe. Americans first rejected tipping as a vestige of feudalism. They said, we're a democracy, we're not a feudal society. But the restaurant industry and the service sector more broadly kind of grabbed onto the notion of tipping as a tool to basically perpetuate slavery, to essentially be able to continue to pay Black people no wage, profit from their labor, and instead tell them, well, you now have the privilege of obtaining tips from white people. And that idea that a worker could be paid nothing and made to live off only tips was actually institutionalized into law as part of the New Deal. When the New Deal passed, and we celebrate the New Deal for so many things that we take for granted in our world today, the right to a minimum wage, the right to a 8-hour day and a 40-hour work week, the right to have a union. Well, millions of Black workers were left out of the right to a minimum wage as part of the New Deal. And tipped workers were one of the biggest groups of workers left out. They were mostly Black, mostly women, and told you get a $0 wage as long as tips bring you to the full minimum wage. And we went from zero in 1938 when the New Deal passed, all the way up to $2.13 an hour, a ridiculous legacy, outrageous and shameful legacy of slavery for the United States of America, to have a wage of $2.13 an hour as a federal minimum wage for tipped workers, mostly restaurant workers, in 2022. And today, Massachusetts, where you all are mostly, is one of 43 states that persists with this legacy of slavery. Massachusetts wage is just over $5 an hour for tipped workers. 43 states, including Massachusetts, have wages of $5 or less, and it is abominable. And it is an overwhelmingly female workforce. This is not as I mentioned at the beginning, this is not a tiny sliver of the population that's earning $2 or $3 or $4 or $5. This has been the nation's largest and fastest growing industry, allowed to get away with paying nothing, pretty much nothing, to their workers, and instead having them live on tips because of the lobbying of a powerful trade lobby called the National Restaurant Association that's been around since 1911. It's led by the chains, the IHOPs, the Denny's, Applebee's, IHOP, and it has fought since 1911 to maintain this ridiculously low wage based on the argument that we shouldn't have to pay our own workers because they get money, they get paid by you, the customers, so we shouldn't have to pay them. So the workforce is overwhelmingly women. 2/3 of these workers are women. We have the highest rates of single mothers among our population. And we also have the highest rates of poverty and sexual harassment of any industry, because you have an overwhelmingly female workforce trying to make ends meet, trying to survive, putting up with anything and everything they get from customers in order to get those tips. Well, there are 7 states that got rid of this system many decades ago: California, Oregon, Washington, Nevada, Minnesota, Montana, and Alaska. These 7 states have required a full minimum wage with tips on top for decades. And contrary to the arguments of the National Restaurant Association, these 7 states actually have higher restaurant sales per capita, higher job growth in the industry, higher rates of tipping, and 1/2 the rate of sexual harassment in the restaurant industry. Because it turns out when you pay a woman a full minimum wage, she is not as dependent on the tip. She gets tip. I live in California. I'm here in California. We tip. In fact, we tip better in California than people do in Massachusetts, I'm sorry to say. But people are not as dependent on the tip because they get a full wage from their boss, like every other worker in every other industry. And that it really comes down to the power dynamic between male customers and female servers. The idea that because they tip, therefore they have the right to harass, even if they're not thinking of harassment, even if the workers are not thinking of it as harassment. That is in fact what it is. And that power dynamic between male customers and female servers got so much worse with the pandemic. With the pandemic in March 2020, 6 million restaurant workers lost their jobs. That was 1 in 4 Americans who lost their jobs in America was in the restaurant industry. 2/3 of tipped workers reported to us that they actually couldn't get unemployment insurance. Even, I'm talking about not just immigrants, but citizens were told they couldn't get unemployment insurance because in most states, they were told that their sub-minimum wage of $2 or $3 was too low to qualify for benefits. And then they went back to work. Many of them, even though they didn't feel safe, The CDC named restaurants the most dangerous place for adults to be during the pandemic. And UCSF Medical School named restaurants the #1 most dangerous place to work during the pandemic, more dangerous than hospitals. So workers knew this. They didn't feel safe going back to work, but because they mostly couldn't get unemployment insurance, they did. And they found that tips had gone way down because sales were down. They found that, of course, health risks, customer hostility, and sexual harassment, which was already highest in our industry of any industry, got way worse. Thousands of women reported to us that they were regularly asked, take off your mask so I can see how cute you are before I decide how much to tip you. Take off your mask so I can see the pretty face of my server before I decide how much I want to tip. And this changed the issue from being an injustice, a racial and gender and economic injustice, to becoming a matter of life and death. And the moment at which these workers were asked to become public health marshals on top of being restaurant workers, when they were asked to enforce social distancing and mask and COVID vaccination card rules on the same customers from whom they had to get tips, they were done. They were done because they said, if I don't enforce these rules, I'm risking my life. If I do enforce these rules, not only do I get tipped less, the vast majority of workers said I get tipped less when I enforce these rules. They also said I am harassed, harangued, beaten. Even in one case, a worker was shot for trying to enforce these rules. So asking them to do so much more for so much less, with tips are down and wages are stagnated at $2, $3, $4, $5, that $2 wage, $2.13, has been stagnated in Congress for 30 years. I know women who, mothers and daughters, 2 generations of women who worked for the same wage, $2.13. It's been stagnated for so long. Tips went down, health risks went up. Now you're asking them to be public health marshals on top of serving and bartending and putting up with all kinds of harassment and violence. They were done. They said, take this job and shove it. And 1.2 million workers have left this industry. Black workers have left the industry at 3 times the rate of other workers because they have faced higher levels of harassment and retaliation than other workers. Women and single mothers have left the industry at higher rates than other workers because they have faced higher levels of harassment. And with all of these workers leaving, even those who remain are not happy and are saying they're leaving. Of the workers who remain, we surveyed thousands of them, 54% say they're leaving the industry, and 80% say the only thing that would make them come back is a livable wage with tips on top. And this, I called it at the beginning, a historic moment. This historic moment of workers, refusing to work for these wages. And think about how historic this is. I like to tell reporters, this is not a once in a lifetime moment. It's not in a once in a generation moment. It's a once in a nation's history moment, because this wage was created at emancipation. It's taken 160 years and a global pandemic for workers in the millions to reject this wage structure and say, I refuse to work for $2 and $3 and $4 and $5. And in response, miraculously, thousands of restaurants that previously said, I can't afford to pay more than $2 and $3 or $4 or $5 are now paying $15, $20, $25, $30. We even saw a restaurant in Cape Cod, Massachusetts, paying $50 an hour plus tips. We created a database where we have been tracking restaurants, thousands of restaurants across the country in the States, allowed to pay $2 and $3, now paying a full wage with tips on top, a full livable wage in many cases with tips on top, because they cannot get workers to come back to work any other way. And this phenomenon, this historic moment, has changed the policy landscape on the issue. So we've been working on this rid for many years in state legislatures and in Congress, trying to get states and Congress to follow the 7 states that got rid of this sub-minimum wage many decades ago. If California, Oregon, Washington, Nevada, Minnesota, Montana, and Alaska can pay workers a full minimum wage with tips on top and have a booming restaurant industry in those states, and by the way, have lost fewer restaurants during the pandemic. If those states can do it, I think Massachusetts can do it. I think most of the country, all of the country, can pay workers a full wage. And in fact, we're finding now not only can they do it, but they have no choice. They have to do it in order to get workers to come back to work in this industry. So we've been working on bills in multiple states. We've been working on bills in Congress. It's been very hard because of the money, power, and influence of the National Restaurant Association, but the moment has changed everything. And I'll give two quick examples and then stop for a discussion. But one quick example is Washington, D.C., our nation's capital, where in 2018, the wage for tipped workers was $3. We put this issue on the ballot, meaning we put it directly to the voters. Should these workers get a full minimum wage like every other worker? And I got to tell you, anytime we put this on the ballot in any state in the United States, it always passes. It always passes, red or blue. Do you know that raising the minimum wage has never lost on the ballot in any state in the history of the United States of America? Because people overwhelmingly in America support raising wages. People overwhelmingly in America, whether they identify as Republicans or Democrats or anything else, overwhelmingly believe that when you work, you should be paid for a fair day's work. So people agree. The only reason this has been in any case or in any remote way controversial, which it is not among the American populace, is because of legislators being in an echo chamber with trade lobbyists like the National Restaurant Association, telling them raising wages will hurt the economy, raising wages will hurt business, which we know to be entirely false given live evidence in the state in which I'm sitting. I'm here in California. We have the largest and fastest growing restaurant industry in the country. So in Washington, D.C., we put it on the ballot in 2018. It passed, but the Restaurant Association got the D.C. City Council to overturn the will of the people with really offensive language like the people were too dumb, they didn't know what they were voting for, therefore we have to roll the wage back down from 15, where we won it, back down to $5 an hour. Well, we filed the same ballot measure in fall 2021, and there's been no opposition, and the chair of the City Council has already announced this is going to pass. We're not going to overturn it. There's no opposition anymore to it because a lot of the restaurants that fought this in the past are now paying it because they have no other choice but to pay people enough to come back to this industry. And what a lot of the employers are saying is, I can't do this alone. I need policy to create a level playing field. I'm raising wages. I need everybody to raise wages. And we need this policy to send a signal to millions of workers who left the industry, come back. It's worth working in restaurants. These are going to be permanent wage increases. So the second example, which I'll close with, is Massachusetts, where we have had a bill to raise the wage for tipped workers to the full minimum wage of $15 an hour for the last 6 years. It's been led by great women leaders in the state legislature who have been fighting for 6 years against really strong opposition from the Restaurant Association that that we should have one fair wage, a full minimum wage with tips on top. Well, just last month, the bill finally moved out of committee with a favorable recommendation to the Senate floor. And it's finally moving in Massachusetts, and it's now moving in dozens of states across the country. In fact, we've just announced that we are moving this in 25 states by the United States 250th anniversary, which is 2026. So I'll close with that, which is to ask us, the audience, the country, we are going through this very historic moment. Things could change. We could actually build back better if wages go up. Employers are starting to realize that these workers are worth more than $2 and $3. And most importantly, workers are starting to realize I am worth more than $2 and $3. I deserve to be paid by my employer a full livable wage with tips on top. So we're going through this huge seismic historic change. The question to the country is, at our nation's 250th anniversary, which is coming up in 2026, it'll be the 250th anniversary of the Declaration of Independence. Do we want to go into the next, quarter millennium with legacies of slavery? Do we want to go into the next quarter millennium with the level of income inequality that we have right now in the United States, which is higher than it's ever been in the history of the United States, including the Gilded Age? We are experiencing the worst income inequality our nation has ever experienced. Do we want to go into our next quarter millennium carrying those legacies of slavery, carrying that income inequality, carrying with it, for you as students of public health, the implications of a populace that is overwhelmingly too poor, too low paid to actually take care of themselves or their families, to feed themselves and their families. 1 in 3 workers in America earns less than $15 an hour. That's a third of our population. What happens to our economy, our healthcare system, our public health, when a third of the country cannot afford to feed themselves, cannot afford to take care of themselves? That's the situation we're in. The question is, are we going to let trade lobbies dictate that we persist with these legacies of slavery, or are we, the people, going to determine it's time to build back better? Thanks.
Thank you, Dr. Jayaraman. That was incredible, and a lot of comments in the chat agree. We've had people from Moldova and from India chiming in as well. I think seeing echoes to their country. I'm going to ask a couple of questions, and I would encourage the audience to put questions in the Q&A. There's a couple, but let me ask a few first, and then I will go to the Q&A in about 10 minutes. So let me start with, first of all, the echoes of the moment with previous pandemics, and particularly sort of the Black Plague in Europe, which of course was the impetus for ending much of the feudal system in Europe. I mean, it was a bit halting over a couple of centuries, but that was the impetus. So the parallel here is very obvious. So I'm just wondering, what do you see as, like, what's the missing ingredient? Like what do we need to take this issue and catalyze it into change? And then I have a follow-up question, but let me pose that one first.
I'm so glad you asked that, because I was so moved by I'm sure you saw it, or maybe you know the author, a guest essay in the New York Times about staffing crises, similar staffing crises, or what some are calling labor shortages. I want to tell you all, we don't call it a labor or worker shortage. There are plenty of workers willing to work in this industry. They're not willing to work for poverty wages, or I would say legacy of slavery wages. Calling it a worker shortage, we call it a wage shortage. Calling it a worker shortage or a labor shortage, it was one really great author in The Intercept who said, calling it a labor shortage is like saying there's a shortage of Mercedes-Benzes for $1,000. That's, it's not that there's a shortage of Mercedes-Benzes. It's not that there's a shortage of workers. It's that there's a shortage of workers willing to work for $2 anymore. And so that it's a wage shortage. So, but in any case, there was this fabulous guest essay in the New York Times about wage shortages or staffing crises following the bubonic plague in feudal Europe, in medieval times. And the point of the essay was that it wasn't like a 6-month or a 1 year or even a couple of years of staffing crises or workers not willing to work for a certain wage. First it was workers not willing to come back for poverty wages. Then it turned into worker revolts and strikes. There was violence, there was repression, brutal violence from landowners and the bourgeoisie. And then there was an evolution that occurred. And as you said, there was kind of a shift in the overall society. And I say that because I think we're looking at a very similar moment. I think the Restaurant Association and the Chamber of Commerce and other trade lobbies that represent big business sincerely hopes that things are going to go back to normal later this year, maybe sometime this year. People are going to go back to work for $2 and $3. And people who've been paying more, 15 and 20, are going to go back to being able to pay $2 and $3. And I am here to tell you, history, not just feudal history, medieval times, but current history, American history for the last several hundred years shows us that is not the case. That is not going to happen. There is no way wages will go back down. There's no way a restaurant currently offering $15 an hour is going to go back, be able to drive everybody back down to $2 and $3 or $5 an hour and get staff 6 months from now. It's not going to happen. And workers are not miraculously going to return to this industry unless they see permanent change. And so to answer your question, I think there's only 2 futures for this country. Either we accept a very shrunken economy. The restaurant industry, I told you 54% of workers who remain say they're leaving and 1 million have left. So either we accept that more than half of workers have left, are leaving, or are not coming back. So that means half the restaurants, half the industry. I'm sure you're all experiencing it. Those of you in America are seeing restaurants that saying, sorry, we can only open Thursday to Sunday because we don't have enough staff. Most restaurants are operating right now at 40% capacity. That's not going away. It's not going to miraculously shift over. There are some restaurants that are busy, but at a macro level, most are not. Most are not at the capacity they were at pre-pandemic, and that's not going to go away. And so the only other option is to get behind policy that will not only create a level playing field, that will lift all boats, that will allow these workers also to eat out, to support their neighborhood restaurants, to consume, but that will also send a signal to millions of workers, come back. These are not temporary wage increases. These are permanent wage increases. And through these permanent policy changes, where we are permanently raising wages, we are recognizing your value and worth. We are recognizing that you are worth $15, not $5. We are recognizing that you deserve to be paid as the professional that you are. So the way to really support this moment is to get behind workers who are refusing to work for these wages and support policy change. If you're in Massachusetts, we would love to partner with you on this state bill we're working on. If you're in any other state, we're moving this in 25 states, so quite likely we're in your state. But also, I think this is the moment to support restaurants that are raising wages, if you're seeing that happen, and let them know, I'm coming here and to let you know that I support you raising wages, but I want to see you keep it this way forever, permanently. We have a list on our website. It's called highroadrestaurants.org, H-I-G-H, highroadrestaurants.org. You can get a list there of a couple thousand restaurants that are doing the right thing, paying better, actually supporting wage increase policies. The thing is to support those restaurants, but frankly, to support any restaurant that in this moment is raising wages and letting them know we want to see it continue that way.
That's one of, you actually anticipated a question I was going to ask. I actually wanted to know how I can know which restaurants are paying a reasonable wage. So thank you. We'll look at that. If I can ask somebody from the team to put that in the chat so everybody has it. Can I ask you just to educate me for a second? Can you educate me on what's the argument that the National Restaurant Association makes, given that you have this natural experiment that there are 7 states that actually have adopted the minimum wage and they're doing just fine? I'm trying to understand what counter argument could there be. I mean, if there were no states that were doing it, you can imagine an argument being made, right? Saying that if we're going to increase minimum wage, then restaurants are going to fail. But we know that's not true because there are 7 states that are doing it. So what's the argument made on the other side? And I'm asking that from perspective of educating ourselves to sharpen our thinking.
No, it's a very good question. And I think it's important to know what their public argument is and then what the real argument is. The public argument is this will kill the industry, jobs will be lost, restaurants will have to close, they will not be able to sustain paying people a full wage, labor costs are already too high, you know, and I have found in every single moment, it's never a good time. So there was the recession. How could you possibly ask us to raise wages during the recession? There's a pandemic. How could you possibly ask us to raise wages during it's never a good time. You know, there's always a bad time. It's always going to kill the industry, doom and gloom. And so it's going to kill the industry, jobs will be lost, restaurants will either have to close or downsize. They won't be able to employ as many people because it costs them too much. A couple of years ago, they also attempted this misinformation campaign to workers saying, if we raise your wages, nobody will tip you anymore. Your tips will go away. And again, we have this natural experiment, like you said, of the 7 states that not only have had higher restaurant industry sales, higher job capita, higher small business growth rates, but also higher rates of tipping. So they knew, we knew that was total misinformation, but they drove a fear campaign. And you all know how, especially if you were here during the Trump years, you know how great of a motivator fear can be. So they drove a fear campaign among workers that your tips would go away if your wages went up, which was based in zero fact. And in fact, the opposite was true, because it turns out when you pay people better, what do? They go out, they spend it, and they tip better because they're paid better. So, you know, I want to say that's the public argument, but last year they were exposed for the truth, and then we know the reality. So last year in Newsweek, David Sirota, who many of you may know is a famous writer, investigative journalist, did an expose in Newsweek that in the same moment the Restaurant Association and the chains that lead the Restaurant Association were telling Congress, paying anything more than $2 will kill the industry, jobs will be lost. The CFO of Denny's and a couple of other chains, but Denny's in particular, CFO of Denny's was telling shareholders on a shareholder call, which was recorded and public, don't worry, if Congress passes 15, we're going to be fine because we already pay 15 and one fair wage, meaning a full minimum wage with tips on top in California. And because of that, he said, Denny's California has outperformed the system. Denny's California has grown faster than Denny's in any other state. In his words, because consumer spending is higher in California, because people are paid better. So Denny's admitted it from their own data, from their own experience. Cheesecake Factory made a similar statement to their shareholders. And so that was exposed in Newsweek. Shareholders revolted. Shareholders said to Denny's, wait a second, if you're telling us that paying 15 plus tips results in the company growing faster, you fighting wage increases in Congress is going against shareholder interests. So there was a shareholder revolt. That was another big expose in Newsweek. But what was revealed is that this is not about fear of profit loss or that this is going to destroy the industry. The chains know they do better in these states. What this is about is just pure profit margins and greed. And the fact that they report as a company quarterly returns to their shareholders. And so when you pay people better, what you do end up seeing, and we've documented this over, even if you look over 6 months, you're going to see less employee turnover, which makes sense. If you pay people better, they'll stay with you longer. Less employee turnover, greater productivity, less employee theft, greater employee morale, better service. All of those things you would see when you invest in workers, maybe not over a quarter, but over just a little bit longer than a quarter. If you are submitting quarterly returns, you are trying to prove to shareholders we've spent as little as possible and made as much profit in this quarter. And so you are going to try to keep wages as low as, I would say, inhumanely possible in every other state outside of these 7 states in order to show, oh, look, I kept my labor costs really low. So it's not that the chains know full well that the arguments are false. It will not kill the industry. It has not killed them as companies. But they drive these campaigns of fear mongering among legislators, among small business restaurant owners, even among workers, so that they don't have to pay more in the 43 states. I hope that made sense.
It's a terrific answer. I keep wanting to ask you about COVID, but you keep saying really interesting things, which I want to follow up on. So let me do one follow-up, then I'm going to switch to COVID. Okay. Has there been investor pressure? Like has part of the movement on this actually intersect with investor pressure to, of course, deal with the shareholders themselves, them pressing the companies? Has that emerged?
Well, that's what I was just describing when Denny's said to the shareholders, don't worry, we'll be fine because we're actually growing faster in California. A group of shareholders that we work with got together and wrote to the company and tried to speak up in shareholder meetings and did shareholder resolutions saying, if you're saying that paying more helps the company, then why are you fighting it? You're hurting our interests. So yes, there is a group of shareholders representing about $4 trillion that has announced that they will not invest in companies that pay a sub-minimum, that they will invest in companies that change their practices. And they've been having regular dialogue with the companies saying, you don't have enough staff right now. Your only choice is to raise wages. And we're already seeing some movement. You know, both Applebee's and Olive Garden's parent company, Darden, announced that suddenly, oh, we're raising wages. Come work for us. You'll get 15. Turns out it was a lie. When the workers showed up, they told them, oh, we're going to make sure you get 15 with tips. So the employer is still paying $2, but they'll make sure they get to 15 with tips, which is already the case. Whereas a lot of independent restaurants, non-chains, are genuinely raising wages from 2 to 15, or in Massachusetts from 5 to 15 and up, plus tips, because they can't get workers to come back any other way. So there is a lot of shareholder momentum and movement to push on these companies, but the chains are dinosaurs, so regressive, and have been at this since 1911, as I mentioned, and so are just so resistant to paying anything more. But I think they're finding now that they're going to have to. We are on the cusp of even the chains having to change their ways.
Let me ask you one COVID question. I'm going to go to Q&A because there's some very good questions there. So can you talk us through a little bit what happened in the industry across the country in COVID in terms of the balancing of risks that workers were facing, the workers' decisions to work, not work? Obviously, it was different by state as well. Can you just give us from your perspective what you saw happening? And perhaps if you can also guide us to what the country could have done better to protect these workers, both from risk, but also from the risk of COVID, but also from the economic shock and all that.
Yes, the pandemic was devastating for this workforce. I mentioned that right at the shutdown, people were destitute. You know, I use the phrase living tip to mouth. These workers, you know, who earn $2 and $3, of course, they have no savings. When you earn $2 and $3, you really don't get a wage. Your wage is so low, it goes entirely to taxes. You're living completely off your tips. And so you get tips one day. I mean, that's how you're paying your bills and your rent for that day. The next day, the restaurants close. You don't have any way to get tips. You are destitute. And that was the situation for 6 million workers. We started a relief fund March 19th, 2020. So just days after the shutdown, and 270,000 workers applied for relief from all 50 states. They told us that in the vast majority, I mentioned 2/3 of these workers said they couldn't get unemployment insurance because in most states they were told their wages were too low to qualify for benefits. And the level of suffering, I mean, it's hard to talk about. We had workers tell us, I don't have money for Metro. I had a worker in Massachusetts say to me, I don't have money for Metro or gas to get to the food bank to get food online, saying, we don't know how much longer we can be in touch with you because we're going to lose our electricity and our internet. We had workers, you know, we were giving out cash payments of $500 to workers. We had workers like down to their last penny. We had a worker who just had no money whatsoever, basically trying to go find food wherever she could. And our cash payment came just in time to allow her to feed her children. It was, you know, people became homeless, people were evicted. I just think this is such a silent and invisible, it was visible to most of you during the pandemic. You saw those long lines at the food banks. You're not seeing what we're seeing right now, which is people are working in restaurants and still homeless. People are working in restaurants right now and still unable to feed their children. People are struggling to pay bills, struggling to make ends meet. Some people have left the industry and are basically saying, I will do anything else or nothing rather than going back to work in restaurants. So they're driving for Uber and Lyft, or they're you know, trying to figure out some situation that they can do from home because they've got compromised family members. They don't still feel comfortable going out working in restaurants or anywhere else. So people were really destitute. So then on top of that, to be told you don't have enough money, you didn't earn enough money to qualify for benefits, was a slap in the face. So many workers said, wait a second, if the government is telling me I didn't earn enough money, I should never have accepted, maybe I do earn too little and I should never have accepted this wage to begin with. It was like a lightning bulb. The government tells you you earn too little. You'd say to yourself, maybe I earned too little. And then they went back to work because they felt they had to, and they found the absolute worst health risks, as I mentioned, of any industry per the CDC and UCSF, highest risk industry. You know, when we surveyed workers in fall of 2020, we surveyed 3,000 workers. 1 in 3 told us somebody in their restaurant had died of COVID. 1 in 3 people said somebody in my workplace has died of COVID. And just the absolute worst was, it isn't, you know, there are other industries, healthcare professions, so many other essential workers, as we call them, that were facing enormous risks. And we were clapping and we were talking about hazard pay for some of these workers. We were talking about protective gear. this was the only industry of essential workers working while many of us were working from home. Essential workers, forget about hazard pay, forget about protective gear. They were told, you get a sub-minimum wage, go ask the same people you're asking to put on a mask to get tips. That's your income. Forget hazard pay. They weren't even getting a minimum wage. So they were asked to risk their lives for the chance. Again, this goes back to emancipation, for the chance, for the privilege that somebody would tip them. And that person is saying to them, well, take off your mask so I can see how pretty you are before I decide how much I want to tip you. You know, people reach their limit. People reach their limit. I mean, when the health risks went from harassment and exposure to the virus to then basically strip. I work with Professor Catherine McKinnon, who's a legendary professor who coined the term sexual harassment and fought to make it illegal. She's a law professor. You know, she called, we together came up with a new phrase for this phenomenon. We call it masculine harassment. The idea that a woman could be asked, take off your mask, you know, so I can see how cute you are and I can determine whether your face is pretty enough to merit my tip. It's a new form of stripping, essentially. And the level of health risk went from just being in the most dangerous environment to also being exposed to take off your mask, to then also being exposed to potentially getting beaten up, shoved, or even shot for trying to enforce health protocols. And workers said, you don't pay me enough to put up with, you never paid me enough, but you don't pay me enough to put up with the kind of health risks and harassment and hostility I'm putting up with right now. And that continues. Workers who worked in the industry for years said they have never experienced a moment where they've experienced as much hostility and harassment as they're experiencing right now, and it has made the industry unlivable.
Thank you. Somebody noted in the chat, there's really some horrifying anecdotes you're sharing. Thank you. Let me ask you a question from Q&A. I'll combine a couple of questions. Can you just address, these are more technical questions, the concern that some people may raise that if you raise the minimum wage, then tips will lower. That's number one. I'll just bucket the other one. And how about raising the minimum wage and the impact it might have on small family-owned restaurants?
Yeah, so on the first one, San Francisco has the highest tipping average of any city in the United States of America, and we have the highest wages in San Francisco of any city in the United States. Alaska has the highest tipping average of any state in the US, and it's had the same minimum wage for everybody with tips on top for decades, actually since the inception of a minimum wage in Alaska. And the reason that those states have higher tipping averages is that when you pay people better, as the Denny's CFO admitted, they eat out more. And restaurant workers, when they are able to eat out more, guess what? They tip better because they know what it's like to be a tipped worker. And so the data shows that tipping goes up, not down. Tipping either stays the same or goes up. And you don't even have to go to those 7 states. Look, in Massachusetts, where many of you are, the wage went from 2 to 5 over the last several years with absolutely no change in tipping. In New York, due to our advocacy, it went from 3 to 10 over the last several years with no change in tipping. So tipping has nothing to do with the wages of the server. Most of you don't walk into a restaurant and ask the server, how much do you earn before you decide how much to tip? Tipping is not based on service. What the data has shown and the pandemic has proved is that unfortunately, tipping doesn't even have to do with the quality of service. Tipping in this country, unfortunately, given the implicit bias of customers, is more correlated with the race and gender, breast size, eye color, and hair color of the server. And sadly, Black women in Massachusetts earn $8 an hour less than white men servers, even when they provide what's called perfect service, because of racism, implicit bias from customers. All of us have, if you don't know what implicit bias is, I encourage you to please look it up. Implicit bias is something every single human in the world, and especially in the United States, carries with us. It's the fact that we have been brought up in a society with structural racism, the images we see on television, in school, throughout our lives, put into our heads structural racism. And so whether we like it or not, whether we acknowledge it or not, we all have implicit bias. And implicit bias results in workers of color and women of color in particular always getting tipped less, even when they provide better service. And what really kind of, I think, sealed the nail in the coffin, or whatever the metaphor is, on this statistic, which has been proven irrefutably at this point, that tipping is actually correlated with the race and gender of the server and the look of the server. The masculine harassment phenomenon that I just described really kind of proved our point, because if so many women were told, I need to see your face before I determine how much to tip you. Clearly, tipping is not correlated with how good of a job she does serving you. It has to do with whether your face pleases me. And for a lot of people, unfortunately, whether your face pleases me is correlated with race and gender and a wide range of other issues related to how attractive we think somebody is, which in our country, unfortunately, is very related back to race and gender. So tipping is not correlated with the wage at all. In fact, it's higher in the States with higher wages. Second question, small businesses. I mentioned a couple of times that the 7 states that pay a full minimum wage have higher small business growth rates than the 43 states, including Massachusetts, with a sub-minimum wage for tipped workers. And that is because small businesses, even more than big businesses, rely on people in their community being able to have enough money to eat out. And so small businesses in states like California and Oregon and Washington, where workers are paid more, experience actually better economic stability among their consumer base and do better. And we have an association of 2,000 restaurants that agree with us that wages should go up. And these 2,000 restaurants are overwhelmingly small businesses. Small businesses are the ones who've led the way in partnership with workers, saying, actually, we need to raise the wage, because small businesses realize, even more than big businesses, that the future is not suppressing wages. It's actually allowing people to be paid so that they will come back and eat out in the restaurant. And so small businesses do better in the states that have higher wages. Small businesses are the ones right now raising wages ahead of the big businesses.
Let me ask you a question. Let's jump ahead 10 years and in the world, and sort of close our eyes, go sleep, jump ahead 10 years. And the world will be a better place by then, we hope, because the world generally tries to be a better place. But and there's another pandemic. None of us want to think about it, but let's just say there's another pandemic. What policy implementation should happen then, at that time, to best protect restaurant workers at the same time as protecting the sector economically, so protect them not just from the pandemic itself, but also from the economic shocks of the moment? So what would you consider to be a gold standard, humane, fair approach from a policy sector point of view?
So I hope within 10 years, we would have raised the wage to a livable wage and ended all sub-minimum wages in the US, the sub-minimum wage for tipped workers, the sub-minimum wage for workers with disabilities, the sub-minimum wage for youth. There's a sub-minimum wage for incarcerated workers, also based on a legacy of slavery. In fact, the exception to the 13th Amendment that allows for slavery in the case of incarceration. So within 10 years, we have to have moved congressional policy, federal policy, to raise the minimum wage to a livable wage and end all sub-minimum wages. There shouldn't even be a thing as a sub-minimum. The word minimum is supposed to mean that nobody earns less than that. That's what the word minimum means. So the fact that anybody's earning less than the minimum when they work in the United States is an abomination. And so within 10 years, we would have raised the wage. We would have implemented what's called indexing, so that the minimum wage continues to rise, not even with inflation, but with average wage growth. That's what we want. We don't, people say, well, minimum wage should rise with the cost of living. The cost of living isn't as well measured by inflation as it is by average wage growth. Minimum wage workers' wages should go up on average, the same as other workers' wages go up. So we want to see it continue to go up, not just go to 15 or higher, but continue to go up as the cost of living goes up. All of that should have happened within 10 years. By 10 years, Dean, we should be talking way beyond that. By 10 years, we should have hopefully achieved healthcare for everybody in this country and a livable wage. By 10 years, we should be talking about how do we allow workers ongoing voice and power in the workplace? Because if you look at countries that really treat these workers as the professionals that they are, and I'm referring mostly to Europe, but there are other parts of the world where workers are treated as the professionals that they are. In Europe, workers are, a hospitality professional goes to school for many years to be a hospitality professional. And they have national unions that they have what's called industry labor agreements, where workers in the industry across Italy, for example, are able to negotiate wages and standards with employers across the industry and the government. That's the kind of thing we should be looking at in 10 years, so that hopefully we would have accomplished raising wages, ensuring people have the benefits that they need, the leave that they need, the working conditions that they need. But at that point, we should be talking about, okay, rather than having to continue to return to the drawing board each time and fight out policy by policy, let's set up systems that allow workers to have voice and power at the table with employers, as they do in Europe, to say, well, this is the situation. Let's make our industry better by doing X, Y, and Z. Those are the kinds of policies we should be looking at in 10 years.
And when a pandemic happens, what do we do?
When a pandemic happens, we'll be more than ready. Our social safety net will not be where it's at right now. Workers will be able to access unemployment insurance. It won't take months and months to get through to the unemployment insurance office to get that. Workers, I saw a question, who should enforce these rules? I don't think the workers were saying, we don't want to enforce these rules, but being told that they had to enforce these rules on the same customers from whom they had to get tips, and not being paid anything more for enforcing these rules, not even being recognized. You asked me a few questions ago, like, what should we have done differently? The word essential became an insult to so many of my members, so many of the people I represent, because it came to mean disposable. That's really what it came to mean. Even though we use the word essential, it came to mean disposable, because we did nothing for we didn't raise their wages. We didn't let them have unemployment insurance. We told them they were lazy when they didn't want to work for these wages anymore. So what we should do in another pandemic is have social safety net ready, pay people a livable wage so that they feel empowered to do things like enforce public health protocols, and ensure we have a healthcare system that allows workers to access healthcare when they need it. All of those things would have been better.
Yeah, and I resonate very much with the arguments. The argument that the challenges of a pandemic are not the challenges of a pandemic; they're challenges of underlying society, and we need to fix them.
Right.
Let me ask you a question from the audience who sends a very admiring note of the work you're doing, which I echo. Can you talk about lessons that you've learned about being an academic, also being engaged in advocacy? How have you navigated both, and perhaps does one inform the other?
Absolutely. I mean, my family doesn't like me having two jobs, of course, but for me, I just can't think of any other way of doing it. I live this word praxis, which is the idea of action and reflection. That's my life. That's how I operate, in that I cannot forgive me for all academics who are here, but for me personally, I cannot imagine just reflecting, just writing, just doing research. For me, I want to be moving policy and changing structures and systems that I'm thinking about. But at the same time, I want to be smartly and strategically thinking about, well, what's really going on here? When I mentioned 20 years ago, when we started this work, everywhere we went, workers would say, it's my wages, my wages, my wages. The question was, why? Why are workers across the country saying it's their wages? So for me, that constant interaction of action and reflection is essential, in my opinion. One aspect of that is that the way we do our research, both me as One Fair Wage and me as the Food Labor Research Center, because we do research together, the way we do our research is through a method called participatory research. We train workers to conduct surveys of their fellow workers in the field. It is the absolute best way to really understand what is happening, the needs and conditions of workers. So we've published hundreds of reports, and now, about 5 or 6 books based on this data that we've been able to gather by workers talking to each other. It's all very rigorous. We go through IRB boards and, human subjects review, but it is it is essential in our mind to have essential workers talking to each other to gather this data and trained to do that, rather than having us as researchers just examine everything that's happening from the outside.
Let me ask you one last question. Your previous book, Fork, which I really quite like, one of the, I guess, metaphoric meanings of fork is a fork in the road for the industry.
Yes.
And can you, I guess I'm asking you to lean into hope, but also give me a reality check. Which one of these forks in the road are we going to choose? Where, I really liked your 10 years out answer, but give me concretely, where are we headed, and how can, if I may add to that, how can everybody here who's engaged in this conversation, who is thinking about this, help get there?
Yeah, I mean, when we wrote that book, Forked, in 2016, it was a little bit more theoretical. I think we truly are in the greatest fork in the road as a country that we almost have ever been, because the country is becoming much more polarized, and there really are two distinct possibilities for our future. I have a lot of hope that we're going to go in the direction I believe in. I have so much hope for that because of what we're seeing workers, how they're rising up, how they're demanding that they be paid their worth. But there is this resistance coming from the National Restaurant Association, coming from the Chamber of Commerce, coming from the industry, the part of the industry that believes that no, change is terrible, change is awful. We need to put our heads in the sand and just go back to the way things were, make America great again, go back to a world in which we could pay people $2 an hour and they liked it and they were okay with it. So there is a world, I guess, in which if we allow our elected officials to listen to that resistance, which unfortunately too many of them are. I mean, look at Massachusetts. Massachusetts, is, people think of it as a very blue Democratic state. You're the home of Elizabeth Warren and Senator Markey. And yet this bill has not moved for 6 years in an entirely Democratic legislature because of Democrats, many of whom are restaurant owners, or some of whom are very friendly with the Restaurant Association. That's where they get their donations from. So there is a pathway where we allow our elected officials to listen to the Restaurant Association that's digging their heels in the sand and resisting change with all of their might. And we all resist change and we keep wages where they are. And we fail. We fail. I don't see any other future coming out of that pathway except failure for the United States of America. What do I mean by that? If 1 in 3 people in America earns less than 15 and we don't raise the wage, and inflation continues to rise as it's continuing to rise, we are completely destroying the ability of Americans to consume. And if Americans can't consume, it doesn't just mean they won't be able to feed themselves or take care of their own needs. It means the economy tanks. I don't know if people understand this. When 1 in 3 Americans cannot consume, the economy tanks. The very same restaurants and businesses that are resisting change are experiencing far less business because there's so many people who cannot afford to eat out or to eat right now. And so we fail as a country in that future where we're resisting change. The other future is the future I think we are headed towards, because I don't see any other choice, which is that we raise wages. We don't just let individual restaurants raise wages. We move policy to raise wages. We've moved policy to get universal health care. We move policy to build back better. And I know we're at time, so to answer your question, please email me. School can provide my contact information. I would love to partner with students, faculty that would work with us on the bill moving in Massachusetts or in any of the other states, or any of the other work we're doing with restaurant owners or workers. We would so love to partner with you. You can also go to our website, onefairwage.com.
Professor Jayaraman, thank you. Thank you for a really, really interesting conversation. And most importantly, thank you for everything you're doing, for your scholarship, your advocacy for both, and really for teaching us all and for engaging with us on this. Thank you very much.
Thank you.